The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. I went to the Imperial Point, and they had such crowds to hear the robotic knee.
Yes.
Oh, here we are. We're here. I'm sorry. Okay. Well, no, I heard that, but I didn't know that it was finished. Dr. Mencia, I just introduced Dr. Mencia. You've just heard who it is, but we were talking about something before. Let's carry on that and go back to that.
So in brain training, when a person, for example, has a TIA or a stroke and they lose part of the function of that section of the brain, because the brain is like a big power plant, and one section of the power plant will provide electricity for a given town and another section for a different town. So if you lose one of the power plant, that town loses electricity. So it does not, the power plant, the main source, is dead, but the rest of the equipment is functional. So my idea was, well, what happens if I use vibration, different type of vibration to touch the area that had been paralyzed or have lost sensation, and then work my way backward to the brain. Because I cannot tell the brain the part that is dead. Being a physician, we know that the part that is dead. It will not come back. But we underutilize our brain. We use about 10 to 15% of the capacity of what the brain can do, regardless of your age. And I repeat, regardless of your age. You can be 98 years old and you still underutilizing your brain. And you can be 23 years old and you are underutilizing your brain. Age have nothing to do with this. Just the way we grow up and the way we have not learned all the things the brain can do, what the capacity of the brain is. We don't know those things yet. Having said that, I say, well, if we are underutilizing the brain, if a section of the brain die, what happens when I stimulate the part that's still workable? Because the nerve coming down the arm, nothing happened to that. It's still functional. Nobody cut that thing off. Still there. So I started working with vibration, and I started, as you and I was saying when we went off the air, there are many things in medicine that can work for everybody out there, but we don't have the resource. We are not privileged to get big donation and say, do research on this, the sound interest. So I did have some VIP patients that pay for me to fly all over. And I have flown to Argentina, to Russia, to or different states here, Canada, to treat people. And I was telling you, I went to one of the person that I treated in Washington, D.C., he was celebrating his 80th birthday, and he was in the private club of the Senate in Washington, D.C. And he was so proud for his 80th birthday. He was so proud that he was able to walk around like nothing happened, like he never had a stroke, shake people's hand. And, I approached him and I say, I'm so proud of you. Look, how are you doing? And he said, no, Dr. Mencia, I'm proud of you for putting me where I am today. So I said, well, you're doing good. He gave me a handshake, and I said, it felt so strong. I said, is that your real hand or you're using somebody else's hand? He said, no. He said, the feelings is not there. So when somebody grab my hand, if they squeeze, I don't feel that much. It feels numb still. But I know that my grip is strong enough because I can see that I'm able to shake hand and hold a pen and put on his tuxedo that he had on for his birthday. So brain training can be can be an interesting concept. Unfortunately, there's not a lot of research out there. But my thesis was, if that part of the brain die, and I know that part won't come back, if I stimulate the part that is working, what will happen to the rest of the brain? Maybe I can go and start recruiting new cells or the surrounding cells. So what I noticed is that by using the tuning fork as a source of stimulation, I started recruiting more neurons around the dead neurons, and the patient had been able to function. So this is a part that I've been doing for many years.
Is this like plasticity that we talk about with the brain? I had an author, a doctor, PhD, MD, I think, who wrote a book on the plasticity of the brain and he's had a lot of patients. He did a lot of research that when you think you've lost it, the brain makes up for it in other areas.
Exactly,
and it's just what you were saying, right? This is a whole new...
And many organs in the body. When you lose, if you lose one kidney, the other kidney will take over and will make over for that. So the brain, you have, in reality, you have like two brains. You have the left side brain and the right side brain, and then they come in the middle and they connect. So when you lose function on one side of the brain, the main section for language is there, and we have mapped the main section for language in the brain. So we think we have. But in reality, there are a second section and a third section. They are backup section. So it's like a computer. You can attach a mechanism that will be a backup memory. So if your computer ever crash on you, you can always go to this backup memory and restore all the information that you had in the computer. The brain is the same way, except that you have 2 or 3 of those backup. So if the first backup memory doesn't work, then the second one will pick up. The brain is very, same thing with the Parkinson patient. We spoke, our last topic was on Parkinson's disease. The same thing with the Alzheimer patient.
I was just going to say something to you about that. Now, that's a whole new kind of a thing, isn't it?
Well, yes, but if you look, some of them are chemical deficiency, all of them are trauma, like an insult to the brain. An insult or trauma to the brain, you lose those cells. They're dead. They will die. When it comes to the chemical imbalance, like depression, bipolar, schizophrenia, Alzheimer, Parkinson's disease, and on, the list goes on and on and on. When you look at those chemical imbalance, they are a way of helping yourself rebalance those chemicals without depending only on just on medication. Because unfortunately, especially in our society, in the Western world, we depend mainly on medication. Where you step outside the Western world, you go to Asia, India, Pakistan, all these countries, they depend more on what Mother Nature can do for you. And when I travel to Asia, I learned so much on what we are doing wrong. And to give you an example, when a person comes to us with memory loss, we do what we call a mini mental status exam to see whether they qualify, meet criteria for dementia or not, or mild cognitive impair or not. But what I have learned from Asia is that test that we do here, if a person read the New York Times every day, if the person is highly educated, they can fool you and show you that they are in the normal range, when in reality they do have dementia. And I remember having a patient that all his kids are loyal in Broward County, Miami-Dade. And the patient was a judge, and he was a professor of law. And he had written all kind of textbook, and he would read the New York Times and do the post, and he come in, and the son say, he's repeating himself a lot. And that's not my father. He's not like that. That was the only complaint. So, of course, I did the mini-mentor status exam, and out of 30, he scored 28. And the 2 points that he lost was in fast recall, when I would say 3 things and give it to me back in a few minutes. And he couldn't recall those 3 things. So he lost 2 out of the 3. So the son said, well, so according to your test, he doesn't have dementia. I say, no, the test is wrong. I think your father do have dementia. It's early stage. He's very smart. And he will try to fool you and fool me and fool himself and fool everybody because of his level of education. This guy, is a genius. So, of course, he is developing dementia, and even though he's so intelligent and so highly educated. So everything have to put on the balance of real life. And that's where we lose, in medicine, we lose that part.
And when Dr. Mencia came in this morning, we always talk about what he'd like to talk about. And it's kind of ironic that I just got started on the brain and you were able to talk about almost on every subject. But I'd like you to just take the time. It's a very important subject. Dr. Mencia this morning wants to talk about make the most of your medical visit. And I've never really heard a doctor even say that or care. But I'm going to let Dr. Mencia, from the physician's point of view, but also as the consumer's point of view, to do that.
Well, I notice a lot of time, and all of us, we have family, we have kids and friends, and it's interesting when a person go to a doctor, sometimes we misutilize our time, and the insurance will pay, or you're going to pay out of pocket for that doctor visit. So if you go to your doctor, you want to make sure that you are making the most and you are getting your money worth for coming to see me, whether you are paying out of your pocket or your insurance is paying for you, but somebody is paying me to see you. And every time you go to a doctor, that doctor is getting paid by someone to make sure that you get taken care of. So you have certain responsibility as a consumer and as a patient to make sure that visit is worth every second that you are with the doctor. So my first advice, Anita, to the people out there is when you make that phone call and you are talking to the operator, lots of time we misuse that opportunity. So when you call and you are talking to the receptionist or talking to the operator, be specific when you make that appointment. Be specific on what is it that you are looking for. What's the reason for seeing the doctor on that visit? You want to review the blood test with your physician. You are having knee pain. If you're having knee pain, did you see somebody else prior to seeing your doctor for that knee pain? This is important because if you're having knee pain and you tell me, well, I saw your pain management department and they already injected me, we are going to make sure to give you advice on putting ice on the knee, not to over-exercise. We will call the pain management doctor or the orthopedic doctor and ask for their record to see what had been done up to now. And that can help us speed up the information that we can utilize to better serve you as a provider. So if you have any kind of procedure done for the knee pain, have you taken any medication that is helping you or is not helping? And make a list of those things because that will help a lot. If you are having knee pain and you are taking a painkiller, most painkiller will help with any form of pain. But if you're having knee pain and the knee pain is due to inflammation, then most likely this is an arthritic type of pain or those sort of condition. So we want to know for that pain that you are having, what is helping you, what is not helping you. One of the things that sometimes we forget to do is we think we are going to go to the doctor and And the doctor is the only person that I should be nice to. And we should learn to treat the office staff with courtesy during that visit. The office staff can be so helpful when you are there. So, sorry. So a lot of time people go into the office and they have such a great relationship with my office staff that they come in, they are in the room, and I see my office staff coming in with a little bag of all the medication that they need, because the office staff, they have already informed my staff, look, I'm in the donut hole, I need help with my medication, and we will call the pharmaceutical company. We will make sure they'll come in. They'll make sure that I sign for those medications so that when the patient comes in, the medication that they need for that month that they are in the donut hole are taken care of, and they don't have to spread out their medication. And and try to learn your office staff by name and treat it like part of the team, because they are part of your team. From the front desk to your nurse to your checkout person, they are all part of your team, and they are all there to help you. It's not only the doctor.
Can I ask you a question, though?
Sure.
And I know you're very busy, and I know your staff's very busy, but let's say you see a patient and you send the person home, or they're an older adult especially. You've sent them home on medication. Does anyone call them the next day to see if they're okay?
Sometimes from the office we call...
I think it's very important.
It's very, very important, especially when we do procedure on the patient. Any
Exactly.
form of procedure, we always call to see how they doing after the procedure. If we do some of the aesthetic that we do there, we call the patient and see how they doing. And also I do some research. No pharmaceutical, sometimes it's not paid by pharmaceutical company because it might not be to their benefit. So some research that have to do with holistic medicine. And in some of the research that we are doing with, we call the patient and see how they are doing with the treatment that we are doing.
Yeah, it's Dr. Mencia, the one thing that I have admired about you is when a patient comes to your office, you're out there. I don't know if you go out and greet everybody or they just bring them up, but I have been there often enough to see you.
They don't let me go out and greet everybody. Sometimes
but you would. I know you would.
Yeah, I escape sometimes. I escape the staff.
I know you would. And there's something that's better than medicine when you greet, just like when you walk into the studio, wherever you go. I saw you at the expo. There's something very special about that you care enough, without your white coat or without anything, that you care enough to say, I'm glad you're here, I want to help you. For me, that's almost half the medicine,
Absolutely.
But let me give everyone your phone number. We always forget to do this, and people keep saying, why don't you tell me his phone number? Okay. If you want to make an appointment with Dr. Mencia or any of his other specialists there, it's the Adult and Geriatric Medical Center. It's located on East Commercial Boulevard, very close to Holy Cross Hospital. The phone number is, get your pencils out. Remember, it's Pencil Talk Radio, 954-489-1345, 954-489-1345. Plenty of parking there. He has his own building. He has a dentist, of course. Dr. Rosemary is there, ophthalmologist, a neurologist, a cardiologist. He is, of course, a geriatric physician. He has a podiatrist, a dermatologist, a nephrologist, psychologist, and if you need something else, he'll find it for you. So, but I want to get back to this. It's a very important subject that you decided to talk about, making the most of your medical visit. When someone comes in, and I think people need to know that they need to have someone else with them. If they're of an age where they don't know quite what's happening, no matter how good you are, what you say to them, Dr. Mencia, they will not remember it.
Exactly.
And they're not writing it down, which they should write it down.
Exactly.
And you as the physician may have to...
It should be a pencil talk.
It should be a pencil talk when they come in, but they should have someone else there, because a lot of times, even if they write it down, they still get it mixed up.
Right.
They should have a person who can be that second person for them.
And, I have such a wonderful staff. Sunita, one of my nurses there, is such a wonderful... One of my patients, who is like, we call him my Jewish father. And my brother, his son, is a doctor, is a gastroenterologist in Los Angeles. and he brought his father. His father was very, very lethargic, and he tried to treat his father himself, and it wasn't working. So he said, "I need your help now." And we gave him an injection. The next day, his father is up and awake and alert and kissing everybody, and Sunita got a kiss, and I got a kiss, and a hug, and what have you. And, he was saying, Sunita is such a wonderful, such a thorough nurse and caring. And a lot of time, she knows how I work. So when I give instruction to a patient, the first thing she does is she pull out her own pad, and she start writing the instructions for the patient to give it to the patient.
That's right.
So I say, here, this is what the doctor say he wants you to do, and she will show me to make sure that everything is right. So we do that for them because sometimes, even if they have a companion, we want to make sure the information that we are giving are carried on properly. So we write it down for them and give it to the patient so that they take it with them.
Well, because a lot of times we know that some patients, for instance, they go to the dentist. They have to be pre-medicated if they have hips or knees, and they may not remember that.
Exactly.
So we really do need to have either a friend. Some people don't have a spouse or someone that they're with. They have to have a friend. You have to really realize that, sure, the doctor's time is valuable, and you may not have the
But we have, at least in our practice, I cannot talk for other people the way they practice, but at least in my practice, I try to keep the standard like a 5-star center. So in my practice, Will, the manager in the front, he will call the patient and remind the patient, and even call the same day. And then Michael in the dental department, who is
he's fantastic. Mike is beautiful.
His work quality.
He is beautiful.
So Mike will call the patient the day before, and then the same day will call you again. Don't forget to take your antibiotic.
Good. Well, but that's what, and that's the problem. That it's true, you're very busy, and I know that, and your staff is very busy, but you can't forget those things. We talked about technology, but I think what people like so much about your practice is that
we still have that human touch.
Yeah, you do still have
that human touch.
Yeah, and you can't forget that, because I still have to tell you, I think that's part of the medicine. I mean, if the doctor, I happen to go to a gynecologist too, and I know he's busy, but when you get finished with the examination, you go in his office for at least 5 or 10 minutes, and he talks to you. I mean, it's like, I hate to do that because I know he's busy, but he wants to see you. He wants to go over everything. And that's how he's always been. And it's funny, and I'm not going to tell you because he's working for a big institution. And I'll tell you something. I guess I can say I have to be careful what I say. No, I'm not going to say who he is or anything about it. But
don't say the name of the institution.
But he said whenever he first meets a person, he wants to see them fully dressed as a gynecologist. In this institution, what they're doing is doctors come in, and they're undressed.
They're undressed.
They're undressed with their little thing on, but he doesn't want to do that. He always wants to first meet a new patient, fully dressed, and talk to them. And he's having a problem now at the institution because that's not fast. But he says, that's how I've worked all my life. That's how I want to be. Right. I mean, I don't even know why I'm saying this, only because
he's put the human touch to the care.
Right, because women have, we have our little peculiarities, and he knew that, and that's what made him
something. And I do the same thing with a hospice patient. The worst thing to do to a person that ends up in hospice care is to send them at the last minute. If I know my patient has, let's say, lung cancer with metastasis, but still fully functioning, I say, you know what, we don't need hospice yet, but I want them to meet you now. Now that you can talk and you can walk and you dress up really nice, let's get hospice to get to know who you are now. Not when you are deteriorating. So his philosophy of care is, it's a humanistic approach to medicine, which we are losing out there.
Yeah, and I hope that we don't have to do that. But getting back to your subject, and I think that was very good.
One of the things that the consumer, because people out there, whether you have insurance or not, whether you pay out of pocket or not, makes no difference. You are a consumer. You are going to a doctor for service. So the better prepared you are, the better service you're going to get. How many times we go to a doctor's office and we say, oops, I forgot to say this. Oops, I forgot to say that. you lost. Now you have to make another appointment and spend more money to get. So make a list of the things that you need. Don't make a 20-page list. Be realistic. You're not going to spend half a day with your doctor. Try during those 5 minutes, make it during 5 or 10 minutes. Say, let me make sure I get in all the information that I need. So even when you are talking to the nurse time is important. And you should let the nurse know what are your concerns, why are you there today, what are the kind of things you want your doctor to attend to, so that he or she can look at your list and then take care of those things in order. When you make that list, first just put everything that comes to your mind and then redo that list from what is the most important to the least important. So if you don't have enough time to go over the entire list, at least the most important topics have been attended to.
Okay, that's great. Well, I think we've done it again. The phone number is 954-489-1345. That's 954-489-1345, Adult and Geriatric Medical Center. And, Dr. Mencia, we certainly appreciate your being so strong in doing this. And I have to just say, before you leave, I want everyone to listen at 4 o'clock from 4 to 4:30 on WWNN 1470 AM to Dr. Rosemary in the afternoon, and she will give you the most wonderful dental information. I have learned so much from Dr. Rosemary already, so please mark that down today and every Saturday at 4 o'clock from 4 to 4:30 on 1470 AM on your dial. And we wish you a very nice weekend, Dr. Mencia.
Thank you. Have a wonderful world of weakness.
Yes, a wonderful world. And we're just moving right on to our next wonderful